How many patients do you see with crowded or malpositioned teeth in a typical workday? Malocclusion affects 3 out of 4 American adults. So how do we get our patients on board with treating the problems malocclusion imposes rather than just addressing the consequences or the symptoms?
Hello, I'm Lauren Gates. Like many of you, I'm a dental hygienist who cares about my patients.
As clinicians and dental team members, we have opportunities every day to educate patients about the connection between properly aligned teeth and health. I'm excited to share 3 short scenarios to help your dental team teach patients how properly aligned teeth can help them keep their teeth for a lifetime. As I perform both soft and hard tissue exams on my patients, I continually ask myself, is this condition related to malpositioned teeth? It's easy to incorporate a 1-second ortho exam into my routine. All you need to do is put your ortho goggles on, have your patients close, and look at the anterior view. There are many discrepancies we can see from this view, and it takes about 1 second. First, I look for clues that there's traumatic occlusion. Simply stated, are teeth colliding rather than sliding? I also look for what I refer to as claws: clefting, lingual inclination, abfractions, wearing, and shifting. It's important to share your findings with the patient using a mirror or intraoral photos. Literally, show and tell your patients what concerns you. So here's what I might say to a patient who, for example, has lingual inclination and gingival recession. See how these teeth are tilting in a bit? This concerns me because your gums are receding. While you're evaluating the patient's occlusion, you will want to identify the problem, describe the consequences that result, and offer solutions. In our example, I'd say, your teeth are tilting in towards your tongue and palate, causing colliding rather than sliding. When they hit together improperly, the forces cause damage to both the hard and soft tissue, which is enamel, bone, and gums. This concerns me because your gums are actively receding. If we don't take your teeth out of trauma, your gums will continue to recede, and you could develop chipping and wearing of teeth at the gum line, as well as increased cold sensitivity. We really need to consider taking your teeth out of trauma by putting them in proper alignment. Luckily, we can do that with clear aligner therapy. You may have heard of Invisalign. It's critical to again show and tell by providing visual aids. So I give the patient the aligners to touch and feel and show them how Invisalign therapy works using the patient case portfolio. When I review the brochure on malocclusion, I reinforce my findings by highlighting the particular problem the patient has with their teeth. Playing the Straight Talk patient education video further demonstrates and reinforces the benefits tooth alignment provides. Now that the patient is 1, aware of the problem, 2, understands the consequences of ignoring the problem, and 3, realizes there is a long-term orthodontic solution available, we can proceed to the doctor exam. I explain that the doctor is on his way and will further evaluate and discuss the condition as well as potential solutions.
So as you can see, hygienists are key to helping patients understand how malocclusion affects their oral health and their health overall. Patients trust us as their healthcare advocates, and they appreciate the time we spend educating them. Knowing that we can help them achieve optimal health through tooth alignment is certainly something to smile about. Now it's time to review your findings with the doctor and set up the discussion between the doctor and your patient. I discussed my concerns with Brian about his teeth not fitting together properly. Showed him how his receding gums, tooth wear, and cold sensitivity are directly associated with his bite. We also discussed the benefits of correcting his bite with clear aligner therapy.
Next, the doctor performs an exam and reinforces what the patient needs to know about his malocclusion.
Once my exam is done, I'll explain why treating the cause is a better approach than treating the symptoms. I'm careful to use terms patients can understand. Instead of saying malocclusion, I explain that a good bite protects the teeth and gums, while a bad bite causes teeth to touch each other in a destructive way. Be prepared to talk about the value of clear aligner therapy and the relationship between aligned teeth and oral health. I say the important thing in your case is to preserve the health of your teeth and gums and to avoid extensive dental work. While you may not have associated tooth alignment with oral health before, I believe that correcting your specific problem could help ensure that you have a healthier mouth as well as a great smile. If Brian's okay with that, we'll offer to schedule a complimentary consultation about his case and demonstrate that Invisalign clear aligner therapy is the best option to give him a healthy and functional bite. It's common for patients to have questions about cost, but we try not to discuss finances until after I've completed the complimentary consultation. So at this point, I would say to a patient, let's have you talk to Sue, our treatment coordinator, who is an expert at making this investment in your health comfortably fit your lifestyle. She'll get some information from you and set up that complimentary consultation.
In our next video, we'll show how the treatment coordinator is integral to help make patients aware of how easy it is to fit Invisalign therapy into their lifestyle. Next, the patient will meet with the treatment coordinator or office manager.
The treatment coordinator meets twice with patients considering Invisalign therapy. In the first meeting, the goals are to collect insurance and flex plan information, then set up a complimentary consult with the doctor to customize a treatment plan.
Brian probably has a lot going through his mind at this point. So before I leave, I ask him, are there any other questions I can answer for you right now? After answering his questions, I let Brian know that Dr. Moralia will be providing more information during the upcoming complimentary consultation. I then say, I will leave you in good hands with Sue, who is our treatment coordinator.
Including the hygienist in the initial part of the discussion helps the patient feel more at ease. As the patient and hygienist discuss clear aligner therapy, I reinforce that Invisalign clear aligners are a great option and that many patients have been thrilled with the results. During my first meeting with the patient, I ask for insurance and flexible spending account information. That way, I'm all set when it's time to present the treatment plan and explain the payment options. If patients don't have insurance or want to pay out of pocket, I reassure them that we can create a payment plan that works for them. This is how I put it. Teeth that fit together properly last longer. Getting your teeth aligned now can be your best insurance policy against costly dentistry later. Before actual cost can be determined, the patient must come in for a complimentary consult with the doctor. This appointment can take place the same day or at a later date. I tell patients we need to schedule 30 minutes with Dr. Moralia and 15 minutes with me. During that time, we'll define the treatment plan and set up a payment program that fits comfortably with their lifestyle.
The second meeting occurs after the doctor consult to discuss finances and finalize treatment plans.
Now that the doctor has decided on a treatment plan, I need to review everything included in the treatment fee with the patient. I explain that all necessary aligners, adjustments, refinements, and retainers are included in the treatment fee. I then state the cost and what may be covered by insurance. It's important to reassure patients that your practice offers payment options to fit individual specific needs. In our office, we choose to waive the financing charges because we found it makes patients much more receptive to treatment and it assures them that the doctor cares about their oral health. My goal is to present the cost and payment plans, then obtain the patient's consent to treatment and his down payment while he's in my office. Once a patient leaves the office, the likelihood of his agreeing to treatment decreases. I'm giving Brian a folder with the financing information and Invisalign brochures and copies of photos taken so he can review everything at home. At this point, he's ready to start treatment. The next step is to schedule a scan or take impressions. I close by offering to answer questions, and I always reassure the patient that other patients we've treated, as well as millions of patients worldwide, have been thrilled with the results. I like to close by reminding them that Invisalign therapy can help them keep their teeth for a lifetime.
So that's it. Good communication and a little confidence will go a long way towards helping your patients say yes. Yes to Invisalign clear aligners and yes to better health.